Hey, I'm here to make a video about getting off of methadone safely because that seems to be a topic that people really talk about on YouTube. And since been a counselor for a long, long time, I want to let you know that the safest way to get off of methadone is 10 milligrams a month, not 5 milligrams a week, 5 milligrams every 2 weeks. No, not unless you're like over sedated and you need to come down, to certain doses quickly so you can stop falling asleep. That's the only drug you're taking. Most people are falling out sleeping because they're taking benzodiazepines, which are Valium, Xanax, sometimes Klonopin, which they overdo. They have the dose is too high, and if you get off of that too quickly, you can go into seizures if you just quit cold turkey. So you don't want to do that either. Also, if you're on a high dose of methadone, it can mask psychiatric issues. So that when you come down in your dose, after you get to a certain point, like say, who knows, 60, 50 milligrams, like one of my patients, you may start feeling suicidal or depression, and I'm not saying you will, but sometimes you may feel a certain way, and you need to address those psychiatric issues. Doesn't mean you can't get off of methadone. It means you have to address them. Go see a psychiatrist, go to the hospital. You maybe need to go on Zoloft or, Prozac or Paxil or what have you, an antidepressant to help with that, and you can still get off of methadone. I don't know why that happens to people. Could be hereditary, could be, damage you've done to your body, could be, you're going into menopause if you're a woman and, the hormones change, or maybe the hormones are out of whack when you're younger, whether it be male or female. There are many different reasons, but the point is you need to address it so you can achieve your goal to get off of methadone safely, unless you choose to stay on it. Um, Also, I want to let you know that if you are getting thrown off a program, you will be detoxed every 3 days, most likely 3 to 4 days, 10 milligrams, which is too fast. Most people will feel sick and won't be able to function, which is why this guy who walked off a program, who I've seen a video on, said, oh, well, I took a fentanyl patch and that really helped a lot. Of course it's going to help a lot because it's an opiate. So you're replacing what you walked away from, and you're not going to feel withdrawal when you have that, to a certain degree, depending on the dosage, because your body gets used to a certain dosage. So, walking off a program, cold turkey, I can do it, and then all of a sudden you hear the client, the person who's making the video saying, well, I'm also taking, Xanax, or I'm taking Valium, I'm taking it 4 times a day. So what are you doing? You're replacing one drug with another, and it's not being monitored, or okay, you prescribed it, but you're taking it and you're still shaking, you're still feeling anxiety. So you need to address that. Add antidepressants and lower the addictive medication that can cause major problems, the benzos. 4 times a day is an extreme amount, unless I don't know, you have extreme severe medical issues. Um, Nobody wants to get addicted to benzos. I mean, I don't see that they're better than heroin, really. Methadone lasts in your system a longer period than heroin does. And the idea of going into a hospital to detox off of methadone is not advisable for someone who's doing more than 2 bags a day of heroin, because you're not going to have enough time to detox because they only keep you for like 5 days. So by the time you get stabilized on heroin, and you can only get stabilized if you're on a low dose of heroin, because you're never going to get stabilized if you lie and say that you're fine, and you're going to go in and say I'm only using 2 bags and you're really using 10 bags a day. And so what happens is you never feel normal. You get out, you just wasted all that money through Medicaid or through your pocket, and you still feel sick, and you end up staying on the methadone on the outpatient, or you end up using heroin. So it's like a no-win situation. So you don't want to lie. You want to get the best treatment possible for your addiction. Okay? So I've never heard of a detox that goes like, every 3 days, unless it's being forced upon you. It's advisable if you don't want to stay on methadone, to keep the goal in mind so it never gets to that point where if you can't pay for the program by either Medicaid, credit card, debit card, money order, that you get thrown off. If you stick with your goal and achieve it in a certain amount of time, then you don't have to worry about being on it for years. Some people stay on methadone for years. Maybe they feel they need to. That's their choice. As long as they're functioning and not hurting anybody, that's fine. I mean, that everybody's different. We don't walk in their shoes. We don't know. But if you want to get off, there's no reason why you shouldn't be able to get off unless you have maybe severe pain issues. That's going to be very tricky, and they have pain management clinics, and they give pain pills, and yes, you can get addicted. And someone on here said, well, I think it's absurd that, you get methadone for being addicted to pain pills. Why? Pain pills are opiates. They have the same withdrawal symptoms as heroin. So you're treating the same type of addiction. It's, yeah, you can decrease your pain pills and start coming down, through the pain pills, but you're not going to be monitored the way you would in an outpatient methadone program. You have a counselor there, you give urines regularly. I mean, doctors are like, hello, goodbye, here's your script, goodbye. How you doing? Oh, well, talk to a counselor or something. Like, they're not going to take the time to give you the attention you may need when you're detoxing off of an opiate. So I hope this helps, and good luck.